Good evening, Littleton, and welcome to the Board of Health meeting for Wednesday, August 27th. Today in the meeting, we have myself, Kevin Davis, as the chair, Matt Wason, and Dan Kane. And also joining us is Francis Dangle and Heidi. If we do have a quorum, so we're going to start the meeting promptly at 7 p.m. And the person that we need to hear from is the public hearing on Four King Road at 7 p.m. If the person who is, oh, and we have Kevin Baker. Promoted him to panelist. If anybody is in the and raise their hand, we will promote you. Here we go. Mitchell? Mitchell, can you hear us?
Yeah, I can hear you.
Perfect. All right. Francis, do you want to read through the notes, please?
Do you want to start with the presentation of what?
Oh, sorry.
What this
Yes.
is about?
Yeah. So, Mitchell, why don't you go ahead and present for what you're proposing, and
So,
maybe share a plan. Do you have a plan to share?
Yeah, I submitted it to Heidi. I thought you guys were going to be able to show the new certified plot plan
Okay.
for the project. So originally we had
1 second, sir. Let's try to get that up. So give me a second. Can everybody see it? Okay, go ahead.
So originally we were trying to get a 18 by 14 foot screened in porch. The issue that the board had was that the footings were closer to the septic leaching field and components than 5 feet. The 5 feet is the the distance from the components in the field that the board is comfortable with. So we had to shrink the screen porch to 13 instead of 18, and then 13 instead of 14, and then change how it was framed in order to get the footings outside of the 5 feet radius of the leaching field and the tank. So we were able to do that. Had to shift it a little bit over, but it's still it's obviously still tight, but it meets the 5 foot setback requirements for the footings, and then also still the setback requirements of the side and rear yards.
Okay, Francis, do you want to read any of the notes?
Yeah, so just to reiterate, originally they came with us for a 14 by 18 screen porch. It does show a 1 foot reduction. Obviously the certified plot plan did change some of those distances, so they are meeting the 5 foot standard. The deck is still in proximity. We did also receive a letter from Kyle Mann, who does a lot of work in town right now. And he said he would have no problem accessing this site because the porch itself was kind of a concern given that the restraints of the lot. And he said he would have no problem going back there if the system ever did fail. Given that he does so much work in town, that made me a little more comfortable. But
he actually also worked to install the original system as well.
Okay. So overall, I mean, they did meet the 5 foot standard. The most concerning thing is the footing. So given that they are able to do that, my recommendation would be to approve the proposed plan.
Okay, thank you for that feedback. Matt Wason.
Francis, your notes just mentioned that the drawing didn't show a third footing. Is there a third footing, and where is it?
There is no, so, part of getting to meet the requirements, the carrying beam is going to be upgraded significantly to eliminate that middle footing.
Cool. Just want to make sure of that.
Yep.
And then I didn't look at the original drawing. Did the porch move northeast on your diagram any closer to that property line, or is that still the same distance?
So originally it was 4'6", where it says 3'4", so it had to shift that way.
Okay.
In order to achieve the setback requirements.
So you'll end up losing approximately a foot of space between that far corner. Oh, but then it went from 14 feet down to 13 feet.
Yes,
so
yeah.
The gap from the closest corner to the lot line is probably about the same as last time.
Yeah, pretty much just
Okay.
on that. So.
Okay. No other questions. Thanks.
Mr. Kane.
No, thank you very much for going back and looking at this. As I can say, we can solution to our concerns from our last meeting. I don't have any questions.
Okay. Mr. Baker.
I have no questions. Thanks for all the clarification.
And the chair has no questions. I need a motion to move.
I'll make a motion to approve the deck patio plans as presented here, showing 2 footings, both outside 5-foot range of the septic tank and field.
I'll second
Do I
that.
have a second? Okay. Let's do a roll call vote. Matt Wason.
Matt Wason, yes.
Excellent. Dan Kane.
Game votes yes.
Kevin Baker.
Kevin Baker votes yes.
And the chair, Kevin Davis, votes yes. Thank you so much, Mitchell, for showing up. We really appreciate all the hard work that you put into it.
Yep. Thank you. Thank you, everyone. Thank you.
Okay, we are just flying along. We got 3 minutes until our 7:10 hearing. And it looks like, do we want to do any, do you think we can do the meeting minute approval for July 23rd before we get to the next person? Feedback. Okay. All right. Has everybody had enough time to read those minutes? Okay. Does anybody have any comments on those? The only question I had was, I chair at that point, or was that the meeting afterwards?
Staff will look into that more closely.
Okay. All right. So I think with that in there, I think I need a motion.
Yeah, other than that, my name was spelled wrong at least one point. So if you could just do it, find him. Double check that.
Sorry. Yes.
Thank you.
So two admin notes. We have a motion.
I'll make a motion to approve the minutes as presented with those 2 admin notes corrected.
I'll second it.
A roll call vote. Mr. Kane.
Dan Kane abstains.
Mr. Baker.
Kevin Baker votes yes.
Mr. Wason.
Matt Wason, yes.
And the chair, Kevin Davis, votes yes. Okay. Meeting minutes approved.
Also, those were Heidi's first time doing the minutes, and she did a really good job.
Oh, thank you, Heidi. Much appreciated.
Thank you.
All right. I think we have about 30 seconds until this. On it, I'll promote Evan so he can get into the meeting. And it is now officially 7:10. So it is now 7:10. Time for our public hearing for 34 Fletcher Lane. Evan, do you want to go ahead and share a plan?
Sure, I can do that. Hey, everybody.
Thank you.
How's everybody doing tonight?
Ducky.
Good, good. All right. 34 Fletcher sharing. Go. Hey, can everybody see that okay?
Yes.
Great.
Thank you so much.
So 34 Fletcher Lane, we are at the end of Fletcher Lane. It's a good sized piece of property, but it is pretty enveloped in wetlands. So what we've got here, it's an existing 3-bedroom home. And we come out the back of the home, and the existing system is noted here by Plan Note 1. We've got a tank in this area. And then we've got a leach field down here near the wetlands. So there was a Title V completed, and we did a test hole nearby, and it was showing that the leach field was below the groundwater table. So we went ahead and did soil testing, and we went further away from the wetlands. We got up out of it in the, I guess it's the other backyard or side yard, to the back of the house to the north as opposed to the east to try to get our leach field away from the wetlands. We did look at changing the plumbing. It is a fieldstone foundation, and with the stone patio and the wall and the steps that are here, it just didn't seem like a great option. So what we've got is we're showing a tank come in. We're pulling it back from the wetlands a bit. We are about, I believe, 11 or 12 feet off the foundation, and then we go down gravity feed into a pump chamber, which is right off of the edge of the field, which will then pump to a Presby EnviroSeptic. It is high groundwater here. We're anywhere between, it's between 2 and 3 feet. So it's 26 inches in 2 of the test holes, and then at 30 inches in the one that was a little bit higher in elevation, but we are holding the 26 all the way for this whole system. So it's a sloped Presby. We are requesting the 2-foot reduction as allowed by the remedial use approval letter. And then it was requested that we add that 2-foot reduction as a local upgrade on the plan as well. So that is the request tonight.
Okay. Thank you so much for that wonderful presentation. Francis, would you care to share any notes? Francis, you are on mute if you are talking.
Sorry.
Okay.
So there's not really many additional notes. Evan pretty much covered everything. The only additional notes would be the property is served by town water. Like you said, significant wetlands, so it is within the 100-foot buffer. Based on our new way of doing permitting, Conservation Commission now gets notified as soon as any plans are submitted. And so we talked to them before it comes before us as well, but it'll also be going before Conservation after tonight.
Okay. How are we handling that if Conservation needs to have something changed or whatever we approve the plan as built? Will they come back around?
They're going to have to come back around. I mean, essentially at the end of the day, we're doing a conditional approval pending approval by the Conservation Commission as well. So if there has to be a plan change, he's going to have to come back with a revision.
Okay. Alrighty. Okay. Why don't we start with Kevin Baker?
Evan, can you confirm the perk rate?
Yes. So we got 3 minutes per inch. We got 3 minutes per inch on this one.
Pretty fast.
Yeah, as you got closer to the wetlands, actually, it got even sandier. So we we perked up here, but we noticed in test hole 3, we got to a grainier soil, but up in test hole 1 and 2, it was more of a loamy sand type soil.
Did you consider picking the whole system up foot because
No.
it was so fast?
No, we went with the 4 foot and then down to 2 foot reduction. In mind, when I was out there with Jim, we were looking at the soil and again, it did vary. And we decided that 3 actually felt a bit fast for what we were seeing up in test hole 1 and 2. Certainly for test hole 3, 3 minutes per inch made sense. But what we were seeing in test hole 1 and 2, we thought actually was we might have hit a better pocket. So we did design accordingly. We've got it sized got it sized well into 10, 15 minutes per inch.
Isn't it at only just 2 minutes an inch? 1 minute
No, it's
less that you're required to pick it up a foot?
Yes, but I'm confident that the soil that we've got, I mean, we are uphill of the testing that had soil in 2 areas it was not the same as what we saw getting closer to the wetlands.
Yeah, I guess my only concern is that, since we're only 2 feet off the 100-foot buffer and we're only 1 minute above the mark where you need to actually pick it up a foot by Title V, that it might be worth just an ounce of prevention to do so. That's my only comment.
Okay. Yeah, there's definite, it's a beautiful property. This just keeping the mounting as low as possible. It's something that, I know all parties involved are very interested in that. The buyers particularly.
Thanks.
Mr. Kane.
I think with Mr. Baker, I agree that it's on paper it's compliant, and I don't think we have any other questions. However, obviously, it's you're close to some of your families. I don't think we have any questions. I think share for those same concerns is Mr. Baker.
Hey, Dan, you might want to reset your mic. It sounds like you're talking through a piece of wax paper, but we got the gist of what you're saying. Okay. Mr. Wason.
So Evan, it's only that initial tank that's actually inside the 100-foot, correct?
Correct. The pump chamber and the field are completely outside of the 100-foot buffer.
Okay, and it's gravity. Okay, so then it's gravity all the way from that tank over to the pump.
Yeah, this is one of those weird ones that could have potentially made gravity, but by the time you factor in what the sewer line would look like, it doesn't make sense. So we went with a pump instead. Yeah.
No, I get it. Question, Francis. Do we have to approve it differently because any part of the system was within the 100-foot?
You do not.
Okay.
Well, one other note, both tanks are called out to be monolithic as well.
Yeah, I saw that.
Yep.
Monolithic and booted?
Not booted, but we can certainly put that in there.
Would that make the board feel a little more comfortable if we had booted tanks? Question.
I think that's an easy thing to do.
Oh, okay. All right.
And not a bad idea. Yeah.
Okay.
I think it would be a sure. None of us are going to say no. Don't do it, Evan. But to Dan's point, this system is now perfectly falling within the criteria we have specified. it's meeting all of the requirements technically.
Yeah. Did you test to see if there are any alternate locations that would work with a standard, or alternate locations to pull it away farther?
Yeah, so we didn't even bother testing the location it is now, obviously due to the proximity to the wetlands. When we started when we started getting up past these trees here, we wanted to keep it below the trees because we didn't want to take them down. And if we were to try to fit it up in this area, we would end up having to take down one or both of the trees due to just the construction or the fill, because we do have some fill that is it's a raise. We're essentially what we're doing is we're going to strip off the A and B, but the bottom of the system is we actually are pretty much using a 2-foot. So we're pretty much starting the sand of the system at grade. So therefore we do have some fill that's going into the 100-foot, but the system is outside of it. So the answer is no. We did test down in this area. There's some space up here, but we didn't test there because it just felt like we knew it was going to be a mounted system. We knew it was going to be high water due to the test hole we did for the Title V. So coming up in this space, it felt like the finished product was going to two things. It was going to end up impacting the trees, but then it was also going to basically be building a mound into the high side of the yard, where if we build a mound into the lower side of the yard, it can kind of tie up into the high side of the yard. So aesthetically, it felt better as well.
Okay. Does anybody else have any other questions or comments? I don't see anybody in the audience, and we were remiss to check the last time, and there was nobody in the audience for the previous time. So nobody there in the audience for any comments. Board members, any final comments? We have one friendly amendment to have everything booted. Do I have a motion?
I'll make a motion to approve the plan as presented with the addition of the boots on the monolithic tanks.
Second.
I have a motion and a second. Mr. Wason.
Wason, yes.
Mr. Kane.
Mr. Kane votes yes.
Mr. Baker.
Kevin Baker votes yes.
The chair, Kevin Davis, votes yes. Thank you so much, Evan, for coming in and presenting. Thank you so much for having taking that friendly amendment.
Absolutely. Thank you very much. Everybody have a great night.
All right. It is now 7:23, and it is just in time for the ID decision support tool. So, Matt, take it away.
Most popular part of the night.
You know it, dude. Come on.
Okay, so COVID-19 is going to get shorter and shorter because the CDC's data is now from May 24th in terms of variants. So they're really not getting any data to update that. So I'm just going to kind of keep watching it, and I'll let you know when it is updated. As we already mentioned, vaccinations are from last season. So the state of Massachusetts has also kind of transitioned COVID-19 into the respiratory illness category. So it is officially out of season now. So that's why you see that the town data hasn't been updated since June 28th for cases, because it won't be updated until the fall when a new season starts and we will start getting new data. Noted the wastewater numbers appear to still be happening, but these are as of August 14th, and I seem to recall those being more current than that. So I haven't seen anything as to why it's kind of a delay there, because that data is usually posted really quickly. This could be normal, I just can't quite recall it, but the numbers have popped up from sitting between the 100 200 now, something over 500 over a couple of days in mid-August. So it'll be curious to see where that goes next, if that means anything. And as I said, we'll keep an eye and post it up there. The bigger news is in the arbovirus category for Triple E, we still remain low in this community, but West Nile virus, we are now at, it's probably only the moderate level because Francis, correct me if I'm wrong, but Littleton did have a positive mosquito sample as well as from at least 3 neighboring communities, I believe. So
We're the only one that hasn't yet.
we're the only one that has or hasn't.
Hasn't.
Oh, okay. I couldn't remember if we actually got a positive or not. So
Everybody's surrounding us,
it's
but
just everybody around us. So
we have that magical bubble. Yeah.
that's good. I love those mosquitoes respecting the property lines.
I love it.
So it's moderate here, but I think it should be well. Make sure people are taking precautions. And Francis, thank you. I know you've sent out some communications to the community lately, which is great. So this shouldn't be a surprise to anybody. And that is where we are at.
Lovely. Speaking of West Nile virus, and I know we've seen some of the stuff going out, and it's really good. I don't believe we need to take any action as a board right now with it being at the moderate level.
No. I mean, I just guess I would say keep an eye on your email in case we do need to have an unscheduled meeting for a situation. But so far, so good. I mean, West Nile virus is not Triple E, so it also wouldn't be the same type of emergency. Most people who do get it do not even know because they're not usually symptomatic. But as more information comes in, I will keep the board updated no matter what it is, and we can make a decision collectively.
Perfect. Excellent. Okay. And then while we're on it, it looks like we have a flyer for in our packet to talk about for the fall vaccinations. It looks like beautiful flyer.
Yeah, our intern was very good this summer. So we have 2 finalized clinics, one on September 29th and one on October 21st. The one on the 29th is going to be more geared towards seniors. We're working with the volunteer corps. We're working with Ayer Family Pharmacy, who we've worked with previously. So as long as we meet a quota of, they said about 50 people, there will be no cost to us. The Rotary Club, though, has generously donated up to $500 for anybody who is uninsured who wants to go to the clinic. So that was huge.
Thank you, Rotary. That's amazing.
Amazing, yes. So we've already started working with the seniors. The Council on Aging has their staff manning phones as well for people who don't want to sign up online. They can also sign up at the new center itself. And it's good promotional for the new center itself as well. So we're hoping it's going to be highly attended. And then the second one seemed like a good place to have it would be at the middle school like previous years to get all ages to come out, just like last year. Last year, I think we did about 140 at the middle school. So hopefully we keep same numbers.
That's awesome and amazing. How does the new CDC or FDA advisor information affect the administration of the vaccines?
Well, I mean, the recommendations. The only contingent we have in terms of our side is it's now 5 years or older instead of 6 months.
Okay. Got it. Does anybody else have any questions for Francis?
Oh, we bought a tablecloth. So I figure, yeah. I figure we're going to be doing more events, and I really think in the next year or so, we should be trying to create some kind of health fair in some kind of form to start. We have Susan, our nurse, attending Westford's health fair, which is coming up soon, so she can kind of get an understanding of what an event would look like, what kind of tables would be there, and we can try to recreate something like that in the next year or so in coordination with some other departments. But as we start doing
the center to do that too, so that'd be amazing.
Yeah, I mean, it's a great promotional tool, but we should really have some kind of tablecloths identifying stations that we could be at different events, telling people that we are the health department. So we put together some basic designs. I'm not very good at it, but it says who we are. So we'll start those at the clinic and use those going forward as well.
Sounds amazing. Anybody on the board share any comments?
Well, I think it's just in terms of the news that's been coming out today. I think one of the questions that I'm unclear on is, obviously, if people come to our town-supported clinics, they're not going to be charged, and that could be a sales pitch for our clinic because there's not a guarantee that, depending on their insurance coverage, that they would be charged elsewhere. Francis, correct me if I'm wrong.
Sorry, the question is, will they be charged if they went to a clinic elsewhere?
Well, correct. So if somebody comes to one of our clinics and they are technically not in the list of FDA approved or CDC recommended groups, so a healthy 12-year-old,
I get your question.
will they be able to get a COVID vaccine from us without cost, or they bring their insurance information and it's still based upon their individual's insurance coverage?
My understanding is the coverage is still coverage, but if they would, no one is going to be turned away, no matter what age, no matter what insurance, no matter any factors whatsoever.
Okay, I'm more just saying, I think the confusion is going to come out is that there could be insurance carriers moving forward this fall that won't cover the vaccination for certain individuals. And unfortunately, that means people who come to our clinics thinking that they're going to get a free shot, that might not be the case because we tried to bill their insurance to get paid, or we provide it no matter what, and we eat the cost. I'm just not sure how the town works with the insurance companies.
So that's why we have the pharmacy do it, so we don't have to. Dealing with Commonwealth Health is really challenging, and it's a pain and a struggle. We will be covering it regardless, so we will eat the cost of what is not covered either way.
Okay.
Family Pharmacy is going to be dealing with the insurance end of it. So as long as we meet the quota of people who show up, that is the only requirement on our end.
Great. So I think that's an important, I don't know how to communicate it. I don't really want to say, okay, well, no matter what, you can show up and get one. But at the same time, people should know that if they typically get it at their physician's office and that's the way they want to do it, or they typically walk into a pharmacy and that's the way they do it, those two avenues could start costing people money this fall, depending on their insurance carrier and what they decide to cover for the vaccinations, unfortunately.
Yep, excellent point.
Okay.
Thank you, Matt, for clarifying what I was trying to say. You said it in so much better words. Thank you. All right. The other question I have on the flyer, this is for the COVID side and for the flu. These are the new fall. So these are the 25-26 fall shots. Is that correct?
Correct.
Excellent. Any other comments? Seeing none. Okay. So it looks like we have covered that. We've taken care of the minutes. And now we are on to administrative matters. Administrative matters. Francis.
Well, just quickly touching on the clinics, maybe think of, do you want to talk some point in the near future about having revolving accounts in the next budget cycle? I think they're important to have, and I think as we grow, I think they are kind of required. So I just want to put it on people's minds.
Okay.
More importantly, administrative support. At this point in time, we have been told tentatively that there is going to be a split between current administrative staff and land use, where the former building administrative assistant will now be covering 45% of health, 45% of 45% of facilities, and 10% of the Conservation Commission. As you know, we had a 50% person before, so this is a little bit of a drop. The situation kind of is what it is. So we're just trying to manage it the best we can.
Okay. Have we started taking on that? Have we started taking collecting data on activities and all that kind of good stuff? So that way, if you're finding out that you're overworked or whatever, that we can start to provide the town with data.
Yes and no. I mean, now that we're going more electronic, we have a lot more access to data itself being readily available. And now that Neshoba is out of the picture, we have numbers that we know that we can use. The biggest thing that we are not currently tracking, which we really should, is that the foot traffic has significantly increased. A lot more calls, a lot more people in office, a lot more emails, a lot more follow-up. It's been a lot, and it really bogs us down a lot. I was surprised by how much. So that is something I'm gonna have to figure out a way to keep track of in between things, but I have not gotten to that point. We're just trying to keep up at this point. I mean, the workload is significantly increased and I'm running around a lot, and just because of the time of the year, you're usually out in the field most of the day at one site. So it's been hard to kind of keep organized in office, but we are keeping on top of the work. And once things slow down a little bit, we will get a better tracking system for everything.
Okay. I was just going to ask if you guys if the eGov thing had an electronic ticketing system.
It does, but then we also have to, I mean, the thing with health numbers is it's not just the number, it's the time behind it. So like with a building inspection, you already know exactly what it's going to be time-wise, where, you know, if you're going to get a housing case, you're going to get a food inspection, you don't know what time it is and no one else knows what time it is. So it's also being able to say what's behind those numbers because no one truly understands the time involved in each thing we do.
Anybody else? Any general comments on that? Go ahead, Dan.
Just kind of for the foot traffic, just to have a sense of what kind of things are coming in for. Is it so they're coming in for files and info kind of thing? Is it coming in walk-ins for submissions? Is it public? I don't want to say. Is it medical, nursing, public health kind of questions? I'm just curious, like what that sense is, so how best be able to help support a plan to address it.
So in terms of the medical, not so much yet. That's still pretty low. And we also haven't really promoted the nurse to that degree yet where we might get more increase in the future. We're still giving her exposure. So like, for example, we recently talked to Neshoba about trying to help connect her to the school nurses and kind of start to building that network. So I think as stuff like that grows, we're going to see a significant increase on that end as well. But a lot of it is definitely files. A lot of it is questions about files. I asked Jim to drop off any hard copies of anything in his building to our office so we did not have to go through that channel anymore. So he did do that. But there's just a lot of questions, and there's a lot of questions that the office admin probably won't be able to answer, and that's no fault of hers. And she tries to the best she can, but usually it requires a different kind of follow-up.
Yeah.
So we definitely see a significant increase there. We do have a lot more people just calling in, asking general questions. I think just went to Neshoba just out of 20 years of thinking that's where you go. And Neshoba has told people now that you need to go there. So that's part of that too. Nothing unexpected, but just, yeah, everybody's getting rechanneled. So
yeah, no, that's kind of, I was kind of curious of where that was. It sounds like it's, truthfully, it's regular operational health department business. So that's expected and good, but it's one of those things that was hard to quantify because Neshoba never really quantified those numbers for us. So it was hard for us to quantify them to town administration of, no, it's going to be a change in practice. And
yeah. I might suggest that we, as a policy sort of kind of thing, start to think about methods and materials to start to track those kinds of things. Like today, we had 17 calls come in, and one was medical, and 16 were informational about XYZ, right? Whatever that is. Just starting to kind of put something together, because I think it would be really helpful as we're coming up to budget season. I think,
Mhm.
right? Knowing what those numbers, what that impact is, that we can start to say, hey, we've had 700 calls in the month of August, something like that. So that way we can start to quantify it. Matt, I saw you come off of mute. Do you want to articulate?
I mean, I was going to say the same thing. I don't know if there's any task more annoying than time tracking if you're like working in a job ever anywhere, right? But we've seen repeatedly over the years that we can't prove what we need, and therefore we don't get what we need. And so the more data we can collect, whether it's from the administrative side or the task side, and I don't think we need to be tracking minutes, but honestly, phone calls and drop-ins. If we have a tally list of phone calls and drop-ins, you can assign an average time to it later and show how much time that's taking. And then you're obviously doing a good job now, Francis, of tracking the food inspections and those kind of things. Similarly, those you will be able to put an average time on to do some math later on and say, listen, this is the stuff we're dealing with that we also, like you said, didn't have eyes open to because all the phone calls weren't going to us. And I highly doubt Neshoba is going to give us call volume records for the past 18 months. So those are kind of, we knew it was going to happen, but had no idea what those volumes are. And so the more we can track that and help open other people's eyes to the workload that this health department is going to have to manage, the better.
Kevin Baker.
Yeah, I think as we get into this, we'll be able to track all the new business that's coming in to the best of our ability. We're just really getting into it, so we're not going to know the time needed. But just in 3 months, we should be able to tell exactly what our needs are and what kind of resources we're going to be asking for moving forward.
Okay. I think that transitions well into the August 2025 report. It looks like that was emailed out. Do you want to go over any of that, Francis?
Sure.
Maybe share it for the community as a whole.
Where are we? There we go. Okay. Share screen. Okay. So we have our basic numbers. One of the more
I'm seeing your
important.
share, Francis.
I was going to say, I'm not seeing a share yet.
Oh. Can you see it now?
Yes.
Okay. All right, so we have our numbers in all categories for the quarter. Most importantly to note is this was kind of a big deal. So New Oriental Market applied for a seafood dealer permit through the state. And to get permission from the state to be able to do that, they reach out to the local health department to ask if they meet the prerequisites to be able to do it. New Oriental Market is not allowed to do any prep work whatsoever. They don't even have the code required equipment to be able to do any prep. Also, dealing with seafood is a high risk food category. And overall, their inspections have not been great in the past. Reading years back, they even had issues with DEP over unidentified seafood being sold, unlabeled, unknown origin in the past. So I made the recommendation that at this time they do not meet any prerequisite to be able to hold a seafood dealer license. One thing in particular they wanted to do was have a lobster tank. In my experience, any place that has a lobster tank is a nightmare, especially in a place that may not be on top of sanitation, logging, just general maintenance. And, you know, if a lobster dies in the tank, the whole tank needs to be completely cleaned out. Every lobster needs to be destroyed, and someone can die. So I tried to make it very clear to the state that no future applications should be accepted until dramatic changes happened in that establishment. The old DCU across from Donnellan's has been repurposed into a Siva temple. As part of that renovation, they built a kitchen into it, where all the old teller stations used to be in the building, for anybody familiar with it. They did a very good job. They're very thorough. The inspection went very well. Right now, they're open for partial service 2 days a week with members. So they are due for an inspection, I believe, in about 3 months from now. So we'll see how they're doing. But I felt pretty good about it overall. They're very meticulous, and they did not spare any cost. The Tetawan Masonic Lodge did a recent kitchen remodel. Thanks to Dan Kane, we were able to connect with them about it. And so I did ask to go out and inspect it. Everything looked good. They did a good job. They didn't really have much assistance in the build, so I was actually kind of impressed how well they did. And they did meet code and everything. So I have no issues. They're all clear. I guess there are some previous issues between the building department and operating, but those have since been resolved as well. Fat Rooster Food Truck, which is located at Farm 359, right across the street from Town Hall. We had tried multiple times to get them to do their routine food inspection for the truck, for operating in town. That was met with silence. We had to start sending out letters requesting and eventually demanding that we inspect the truck because it had been so long, and it's a health hazard to not be inspected for that long. That was obviously non-responsive as well. So I called the town clerk and asked them if they'd be able to possibly put a hold on their business license being renewed until they received an inspection from the health department, as well as a permit renewal from us as well. So at this time, we have seen a new truck called Stack and Season. Supposedly is not operating at this time, but we are keeping an eye on it. And they're not allowed to get their business license approved as well. So between the two departments, we should be able to get that done one way or another in the near future. We did have one unconfirmed foodborne illness complaint. Usually we do get 2 or 3 per quarter. That's not unusually high or unexpected. In that type of situation, we go to the establishment. We take the notes from talking to the person who made the foodborne illness complaint. We check the food that was made. We ask them to recreate the food and the steps that are taken so we can see at each station if there is any chance of cross-contamination or bad food safety management. In this case, there was none. And then some stuff that we already talked about is just transition notes.
Francis,
Yep.
before you move on to the next section,
Sure.
I was glancing. So Fat Rooster is officially not then permitted in Littleton right now?
Correct.
Okay. Because I was just checking the list of food trucks. And since I was on the list of food trucks, could you get in touch, or if you maintain it, I don't know who maintains it, but could it potentially be alphabetized by food truck name? Because I love that we have the list and we're maintaining it better, but if you're actually looking to check if something's on there, it's just kind of, you got to do your own eyeball search, and I miss things sometimes. So much appreciated if that could be alphabetized.
Yeah, in all fairness, I haven't looked at it in a while.
Okay.
So it probably needs updating as well, but yeah, we can definitely make a change.
Okay, thanks.
In terms of environmental, the rest was related to transitional stuff. So as everybody knows that we made a final transition as of July 1st. That is when we went as online as well to better keep track of permitting. So everything has been built out in the system over the past year, so it was ready to go. Of course, there were kinks, so we're kind of learning as new permits come in and making adjustments as we can. But so far, not so bad. A lot of this point is just making sure that we're notifying people to come to us instead of Neshoba. So we're going to try to be proactively, especially with the food permits that are becoming in October. So we'll be sending letters out to each establishment this September to make sure that they are ready. We anticipate having to help people in some instances apply online, so we are ready for that as well. Most permits that were with Neshoba, we have honored till the end of the permit cycle. So no one that is already working in Neshoba and has already been permitted is not required to get a new permit at this time. But if they are new to the town, they would be, obviously. And then we talked about increases in time with the public. Does anybody have any questions on the environmental health report? So the community health report, this time I worked with Susan to kind of add in things that she had been doing in the community and kind of how she's been setting up in office. I thought it'd be good to get an understanding of what our nursing is going to look like at the intro point and things we're doing. And obviously the board can look at that as well. And, you know, any suggestions are helpful. It's new to the town. It's new to us. So I'm building the best I can, but we are learning along the way. A lot of it has been, I've been connecting Susan with our neighboring towns and trying to build her resources and kind of build a community where she can turn to. Tamara Bedard from Neshoba recently transitioned to a state position, helping our region. So we connected with her, and she is now meeting with Susan once a month to just talk about the work in Littleton. And with her history in Littleton over many, many years, she's been able to help her kind of navigate certain things as well, which has been helpful. We also navigated, as I mentioned earlier, with Alicia Lepard from Neshoba as well, who was the main contact for the nurses in Littleton. So that's been building out her network as well. If we look at here, we have our cases for the quarter.
That was going to be one of my questions, Francis. That it doesn't say anywhere on this page what the time frame is.
Oh, sorry. So okay. Third quarter.
Okay.
Yeah. I'll put quarter numbers on the next one.
Okay. And then by community, is this Littleton only or?
This is Littleton only.
Okay. Thank you.
And obviously we're still 2/3 of the way through the third quarter, so it'll be a final quarter report at the end of September. Is that right?
So at the end of the year, I'll create for you a kind of full year kind of review and just numbers and information of everything, just so we have a record too, because that's probably something we will use as part of the budget process, I think, too.
Yeah, seeing how it was only from July 1st.
And then there'll be a question of like sourcing. Is this all through state database?
So this is through the Maven database.
Okay. And then I guess there'll be some that I think I assume Lyme disease is the most likely culprit, where you have probables that will hopefully, for the patient's sake, turn into confirms or turn into negatives. And so I guess we just have to know as a board that sometimes numbers will like bounce a little bit even between quarters as a case changes from confirmed or probable to confirmed. Just comment. That's all.
Any other comments on that section? All right, let's roll.
So we have our Fluplex listed for this fall. Mosquito and tick information. So I sent out, was about a week and a half ago, maybe. We did a promotional educational campaign on ticks because there have been increased cases. So we sent out a press release just kind of talking about that. We also created a PDF of just kind of factual and statistical data. And then we also purchased 150 tick removal kits. They're pretty neat. They weren't too expensive, and they sold out within 3 days.
Woohoo!
Yeah.
Nice.
So yeah, good first educational campaign.
Did we order more? Did we order more?
I didn't have the budget enough for that.
Okay.
So as part of the revolving accounts and programming, I mean, that's part of what we'll talk about in the fall. I think we'll be able to support that. So we'll do small campaigns just to show that there is a need and that it does fill a void. And then we can support it in the budget for the next year. And a lot of our work now is trying to connect with EHS to be able to promote these projects because it's going to be the most actively engaged population. Susan did mention some meetings that she does go to. I think they're very helpful meetings, especially the regional epidemiology meeting. Susan is working on an educational campaign for maternal child health work group. She's working on a resource document now. I think she's about halfway done. So we should have something in the next couple of weeks for the board to look at. Finally, just an administrative, any points that may not have been covered in any of the above reports. Also some focuses that we're working on right now, as well as some upcoming focuses that we'll need to look at as well going forward. Recently we did yesterday receive something from the Tobacco Free Generation Coalition, asking if we wanted to have them present to the board on their proposed model regulation for making an age cutoff for tobacco sales within a town. Some towns have done it at this point. It'd be for a future discussion of whether you would want that or not. But I was going to send that out. I'll send it out tomorrow for the board to think about for an upcoming meeting. But our tobacco regulation, why I mentioned it hasn't been updated since 2018. The Modern Tobacco Act was 2019. So I think that's a regulation we should just double check to make sure we're fully up to date on in the coming months as well.
Okay. Anybody else have any comments on that section?
Oh, Sharps program. I also wanted to mention that that's something that'd be part of the revolving fund. So previously, Neshoba has carried out a Sharps fund. They would collect a small fee. They would store Sharps and pick them up, usually about a quarter, Jim said. We have gotten a lot of questions about it since leaving Neshoba. There's definitely a need. I think it's worthwhile. So I've been looking into figuring out how much it would cost us and what stuff we can do and make sure that we can meet the requirements of the code. But it is potentially possible. I think it's probably something that would be worthwhile to consider. Jim has said that he will still accept Sharps from Littleton residents, but it might be worthwhile to do it in-house.
I fully support this. The number of GLP-1 medications that are on the auto injectors, as well as EpiPens as
Mhm.
auto injectors, and whatever other sharps for like diabetes management and everything else like that. I think we should definitely look into something like that. I know last year when I needed to turn in a few sharps from expired EpiPens, it took me a solid week to find some place that would take them. And the place that we went to was our doctor's office, and they were very hesitant to take them, even though they were the one that prescribed it. So, yeah, having this service in town would be a huge thing.
Within a revolving fund, it will pay for itself if we charge a small nominal fee, same as Neshoba, basically.
I think that makes. I've got three auto inject. I've got three EpiPens. I'm looking for a place to put because the doctors have said no. So it's kind of interesting. CVS won't take them, so it's kind of a missing thing. I've also reached out to our legislature and wrote them a note as a private citizen to say, hey, this is a problem. The state needs to figure something out. And I got a and thank you for your concerns. And well, yeah, it didn't go anywhere. So
One other thing that I just want to highlight is the Public Health Excellence Grant. That is something we were working on last year, and we had multiple meetings with Westford to talk about doing something with them. And the understanding at the time is that we'd be able to take the money that we were allocated as part of Neshoba in that grant and be able to shift that as we left Neshoba to start a new venture. When we went to do that this spring, DPH was not responding to our emails and calls. That raised some concerns. So I reached out to our state representatives and I asked them to assist in getting DPH to respond. They eventually did and told us that they would not make any contract changes, no money would be moved. There is nothing we could do until the FY27 contracts. Obviously, that's not a good answer. So I brought it to town council, and they have been reviewing it and trying to work through it, but it's not looking good.
So when you got assurances that that would transition over, was that in writing?
No. Yeah, it's on me.
Okay. And town council is saying that it's not looking good because the contracts say there's contract language in there that says it can't be transferred from one place to the next.
Yeah, I mean, just generally, he says that they have the right to be able to do that. I'll get more details on that as we get to a final stage, but
that sounds wonky from a contracting perspective. Seeing how I've played with federal contracts and I can move them around all the time. Interesting. Okay, it's a state thing. It's a state thing. Anybody have any comments on that? That really sucks. It's a whole fiscal year of money too.
Yeah, it was pretty much a done deal.
Okay. Is there anything that the board could do to maybe assist the town? Or is there?
I think it's legal at this point to be able to make a challenge to their points. I don't think we're going to get a personal plea that's going to change their minds.
Okay. Is there a conversation that we need to have with the town council to strongly, vigorously, or whatever adjective, adverb you want to put in there to tell them to look for a corner case or something like that?
I think it never hurts.
Okay.
I can help you draft something.
Okay. Board okay with that? Okay. All right. Is there anything else you want to talk about in that packet of information? Anybody? Matt, Dan, Kevin. My only question about the report is, are we recording and presenting all of the legally required things for tracking? So like if we needed to track the number of thumbtacks injuries or something like that, are all of those items that we need to have that were required to track in that report?
Yes. I mean, in a general sense, we are now meeting every state mandate that we're required to meet where we might not have been meeting them before. And that's what it boils down to.
Awesome. Okay. Because I know that was a concern that we had talked about before and a bunch of other meetings. You know, Dan had brought it up. I know Matt and Kevin had all brought it up. I know we talked about it at our offsite meeting as well. So congratulations. Thank you.
Mhm.
Does anybody else have any other matters that they would like to discuss? Francis included?
Oh, sorry for being depressing.
No, it's all good. It's all good. All right, why don't we go to individual, where are we at? Okay, so that's administrative matters. Yeah, okay, correspondence. Why don't we go to the crowd here? Matt and Dan and Kevin, anything that you would like to bring up in chat about? And shaking his head.
It might be worthwhile to write a letter to the Rotary Club thanking them for their donation on behalf of the board if you want me to draft something up.
That would be wonderful. Let's do that. I'll even come and offer my Jan Hancock to sign it.
You got it.
Get official. Kevin, anything you want to share with the meeting?
No.
Okay.
Thank you.
Oh yeah, no worries. Matt, anything to share?
Nope.
Okay, I have nothing else to share. So thank you so much for that, everyone.
I have one more thing. Sorry. Heidi's
close.
getting married. Heidi's getting married Friday.
Oh, congratulations, Heidi.
Thank you.
That's awesome.
And she's a resident.
Whoa,
Yeah.
that's awesome. Well, congratulations to you and yours. Have fun with that. I don't see any other people in attendance. I don't see anything else. We are at the end of our agenda. Oh, yes, Mr. Baker.
Mr. Chair, I'd like to make a motion to adjourn.
Do I have a second?
Second.
I have a Mr. Baker motion and Mr. Racing second. I'll do a roll call. Mr. Kane,
Mr. Kane votes yes.
Mr. Wason,
Matt Wason, yes.
Mr. Baker,
Kevin Baker votes yes.
and the chair, Kevin Davis, votes yes. Our meeting for Wednesday, August 27th of 2025 has concluded.